Good morning. I'm Bill Wilson with AARP, and just to sort of mention a couple of things. One is that in looking at the Medicaid budget, which is also a big part of the state budget and of course also receives federal dollars, but in North Carolina, one thing that we've been very fortunate is that we have what are referred to as optional services under Medicaid for low-income individuals. And so a lot of those services are not mandated by the federal government, but the state of North Carolina has made a decision that these are important kinds of services to provide to people, and many of them, as was said, many of those services are designed to provide care for people in their homes and in their communities. So it keeps them from having to be institutionalized, which ends up costing us a whole lot more money. And the easy example of that is that if somebody is able to receive health services, a nurse aide that comes into their home to provide some services for them, that individual is still paying their electric bill, they're still paying their rent or their mortgage, they're still buying their groceries, those kinds of things. But if they lose those services in their home and can't afford to stay there, or CHIP's not delivering a meal to them so that they're not able to fix food for themselves, they have no choice but to go into some kind of institutional setting which costs more, and then Medicaid is paying for the light bill and for the facility and for food and all of that stuff. So it is, classic penny wise pound foolish kind of thinking to cut these optional services. The other thing that was mentioned is this home and community-based care program, which is, I would say, the single most important issue to AARP in North Carolina, the thing that we advocate most strongly for. And this is also a wonderful program that takes some county money and federal money and state money to provide services, and it's done in a block grant so that it comes to Cumberland County, and then your elected officials can make a decision about what is it we need in Cumberland County, because what you need in Cumberland County may be drastically different than what's needed in New Hanover County or Wake County. So the decision making about how that money will be spent, and in many cases it's for home delivered meals and other kinds of in-home services and programs in senior centers, is made locally. So that decision is made locally. So that's enormously important that we continue those programs. I'll add just one other thing, that in the short session, the legislature appropriated an additional $2 million for the Home and Community Care Block Grant Program, and because of the budget shortfall, that money was held back and not allocated. We had a waiting list of over 15,000 people in the state for those services even then, and many counties don't keep waiting lists, or they say we'll keep 100 people on the list and we won't take anybody else until we reduce the list a little bit. So we know minimally the need for those kinds of services is at least 15,000 people in the state, and growing as the state gets older, just like it is in Cumberland County.
Yes, a lot of good information.
I'm with the Area Agency on Aging.
Thank you.
We're a regional office, and we cover 3 counties, Cumberland, Harnett, and Sampson. And I understand, the tight budget situation that we're in, and I'm appreciative of that, because we see seniors all the time that are in very tight budget situations. And I understand that we have to tighten our belt, but a lot of these seniors have already tightened their belt many years ago. I am really concerned about the funding for the Home and Community Care Block Grant. In Cumberland County, those services are divided up. We fund adult day health care, medical transportation, general transportation, and when we say general, we mean most of the time taking people to nutrition sites so they can have a congregate meal. They're allowed to have 1 shopping trip a week on the way back, so they're being good stewards of the money there. There's in-home aid service that allows people to stay in their homes. And as has been said prior to me, every time you can keep a person in their home, it saves the taxpayer some money. When they go to long-term care facilities, there is a potential for that to cost us as taxpayers more dollars. The other part of that too, in being able to stay at home, is the comfort And as you age, you like to stay where you're the most comfortable. And staying in your home is staying in familiar surroundings. So I am concerned about those home and community care block grant because it says home and it says community, and that means staying in your home, staying in the community, staying a viable part of the community. One of the best stories I had ever heard, and it kind of gets to the core of the home and community care block grant funding, is there was a lady who was handicapped. She was not able to get out of her home, but she would spend every morning on the phone making sure that others in the community had what they needed. So she gave back to her community. She did receive a home-delivered meal, but she could be on the phone. She was confined to a wheelchair in her home, but she could actually take that time and take care of others. So not only was she a recipient, but she was also a giver. And so that's one of my major concerns is let's don't lose any ground. Let's keep what we've got, and we'll tighten our belts the best we can. But let's keep what we've got, because as I'm the first year of the baby boomer, and there are a whole lot coming behind me. I'm like khaki, I'm still working. But there are a lot of people just like me, and a wave of them coming behind me, and I'm really concerned if we don't keep what we've got where we are right now, when that wave comes, what are we going to do?